Welcome to the Barrier Breakdown, Disrupting Mental Health podcast, where we talk about the clinical and practical issues that face those working in the mental health industry.
Hello, everyone, and thank you for joining us for this week's episode of the Barrier Breakdown. My name is Erin Melano-Bailey. I am the Chief Operating Officer at Cognitive Behavior Institute, and my co-host, Dr. Kevin Caradad, who is the CEO and owner of Cognitive Behavior Institute. On this week's episode, we are very excited to share with you our guest this week is Dr. Samuel Chawner, who is a research fellow from Cardiff University's Center for Human Developmental Science. His research integrates genetics and psychology to provide new insights into child development and autism. So thank you so much for being here with us, Dr. Chawner. We're very excited to have you as a guest.
No, thanks. It's great to be here.
Yes, thank you so much. Could you begin with telling us and our listeners, how did you become interested in researching genetics and child development?
I think it started when I was an undergraduate and there was a module on genetics and psychology, and I just became fascinated on sort of the nature-nurture aspect of human behavior. And then that led me to study psychology and genetics as a PhD. And then I've been working in it since.
Wonderful. That's it sounds like you certainly had an interest as you began studying it. Can you tell us a little bit about your recent publication on the genetics first approach to dissecting the genetics behind autism?
Yeah, so within autism, there's this sort of saying that if you've met one person with autism, you've just met one person with autism, in that individuals with autism can vary a lot from each other in terms of verbal skills and in terms of long-term outcomes, in terms of independence and independent living. And there's a lot of research interest into why there's such large differences in the outcomes of autism and whether we can predict this. And one area people have been looking at this is genetics, so whether there's different genetic subtypes of autism. And we wanted to look at this, and there's an opportunity because there were 4 genetic conditions that have been linked to autism, and we were able to identify individuals with these autism-related genetic conditions through clinics and do assessments. And we were testing the hypothesis whether different genetic conditions led to different types of autism. And in fact, what we found was actually a bit more nuanced and complex. We found there were differences, but there was a lot of overlap, suggesting that actually our understanding of autism is probably more complex than we first thought. But also it highlighted that individuals with these genetic conditions who didn't meet criteria for an autism diagnosis experienced a lot of symptoms on the spectrum, and their clinical needs weren't being looked at. And it raised the question to us whether actually an autism diagnosis can miss a lot of people who still need clinical need.
That's interesting. So if I hear you right, there's individuals that don't meet necessarily the DSM criteria, but they're not there as far as symptoms. Are you seeing so if you see them from the symptoms perspective not meeting criteria, are there similarities from a genetic perspective that you saw in your research that maybe would be a little bit more inclusive?
I guess what's difficult is in most autism research, you have to have a diagnosis to be part of the study. So there's not that many studies out there. There are population-based studies that show there is a spectrum of autism traits, and there are individuals who may have just, say, communication difficulties, but not repetitive behaviors. But in terms of kind of identifying clinical patients, we were only able to do this because we were starting from a genetic point, and then we saw there's this quite large subgroup who say had communication difficulties but didn't have repetitive behaviors. So yeah, I think it's an area that needs to be focused more widely in psychiatry.
Yes, Kevin brings up a good point when he talks about behavioral health practitioners who are working with clients with autism. And frequently, these mental health providers are not using genetic testing to aid in their diagnosis of autism with clients. Do you foresee in the future that might be something that could be changing?
Yeah, so like within the UK, we have NICE guidelines, and one of the considerations following an autism diagnosis is referral for genetic testing. Currently, it tends to only happen if there's health comorbidities. So if the individual has kind of congenital abnormalities from birth, or if there's comorbidities in terms of intellectual disability. And the idea is that the genetic diagnosis may link up these different health domains, whereas previously professionals have just been looking at things individually, such as autism or the physical health. It could start connecting up these areas.
That's interesting. One of the things that comes up, I think when you look at the UK versus the US, our health system here is very compartmentalized. There's no connection. So collecting data is a little bit more difficult. But my understanding, and if I'm correct, let me know, is the UK is typically more of a national health system, and everything is kind of interconnected, particularly like electronic health records and data. So can you speak to that, and how is that helpful, and maybe educate us a little bit here in the US about maybe how we could benefit by having greater synergies in our health systems here?
Yeah, so within the UK, we have a medical genetic clinic network, and there's a medical genetic clinic in each region of the UK, and in them they have lists of patients who can be recontacted to take part in research. And so we did this as part of this work to identify individuals with these autism-linked conditions, whereas you wouldn't be able to do that in the US. And also another important factor is that the genetic testing is at no cost to the patient. So it means there's greater accessibility. There are still some issues in the UK in that a lot of the records are still on paper lists, or they're not all connected electronically, but work's being done to upgrade this. I think the countries that are really leading this work are the Scandinavian countries. So in Denmark, you can access the population's health records, and it can be linked to DNA blood spots available at birth. And so there's really interesting work coming out of those countries.
It sounds like the UK is really doing an excellent job at breaking down barriers, and it does sound like there's a lot that the UK could learn from, that the US, could learn from that. So that's very interesting.
Yeah, because we combine data from the US and the UK, and there's some indication that the families who identified with genetic conditions in the US were perhaps from higher socioeconomic backgrounds due to kind of access to insurance and so on. There are studies happening in the US, but it tends to be more through patients identified through sort of social media or through patient advocacy groups. There isn't this kind of centralized sort of healthcare system approach.
Any ethical issues come up with regard to testing? At birth with Scandinavia, at least you could go back and pull it. What does that look like there in Europe and Scandinavia with regard to access? Who has access? Who do you need to get permission from the clients? What does that look like from the system?
It's really interesting. You could do a whole kind of show on the ethics of this. So I think in Denmark, you've got to be a registered researcher, and I think their data can't leave Denmark. So if someone wants to analyze the data, they've got to actually physically go to the national registries and do the analysis there. And any analyses have to be approved by kind of a central ethics committee. I believe that you can opt out of the system if you're a Danish citizen, but and I think they found that right, so they don't do kind of an opt-in procedure. But I don't. It does raise up lots of ethical questions, and
it is complicated. Yeah.
And sorry.
Okay.
Yeah, and there's kind of questions about what if we identify new genetic risks in the future. 'Cause at the moment in their system, they wouldn't be able to go back to those individuals, and it's whether that's ethical or not, and how should research be interfering with clinical care, and yeah.
Sounds like its own doctoral work would be necessary for that to parse that out. One of the things that's front and center here globally is COVID. And I'm reading a lot about these comorbidities of neurologic and behavioral health problems coming out of that. So I'm wondering if you can speak to any of that. I know it's really early on. This is not out that long. And specifically either autism or your work in genetics, any correlations you guys hearing about, even just whispers at this point?
I'm just hearing that individuals with autism or individuals with intellectual disability are a potential greater risk of COVID. And there's been talks, say, in the UK, whether carers should be prioritised for vaccination when they're working within, individuals with intellectual disability. And that's with individuals with rare genetic conditions, a lot of them are shielding currently in the UK, and they're receiving even less kind of health support than they were before COVID, because a lot of things like speech therapy or the services they were accessing have just basically shut down during COVID.
What are you seeing about any additional data or information, at least specific to the UK, with regard to increased behavioral health problems with those that never had them before, those that have them in a severity level, and how is it being addressed? I know it's here in the US, it's become a real problem. We're seeing a huge demand and trying to struggle there. What has been the UK's experience?
So I think there have been surveys showing that anxiety and mood problems have increased in children and young people over COVID. And I think the statistic now is that over 1 in 5 young people are experiencing difficulties. And there's a big debate in the UK about whether the risk of opening schools in terms of COVID versus the risk that it has on children's mental health and vulnerable children. And I don't think we're at the right answer yet, but it's certainly a debate that needs to be continued.
Yeah.
Is the UK, do they have different schools open in different parts of the countries, or is it collectively, has there been one decision made on during COVID if the schools are open or closed? Could you share with us a little bit about that?
So it's devolved within each of the nations of the UK. So there's been a lot of debates because, say, in Scotland they've closed the schools, but perhaps not in Wales, and vice versa. At the moment, there's been all schools have been shut down within England, and they probably won't open again until March. But yeah, within a nation, there's kind of consistency.
Sure,
Yeah.
that's pretty much how it is here in the US too. Actually, it's dependent on the surge of the virus in the area, or the government of the state officials, how conservatively or not conservatively they've been handling the school closures. So that's very interesting. And to circle back to your point regarding the services and the decline in services when schools are closed, can you speak to a little bit about how socioeconomic status in the UK either does or doesn't play into the role of clients who have autism and their access to services?
So I think there is some evidence that socioeconomic status can make it difficult to access services. And I know within the medical genetic services, there's sometimes because services are stretched. Sometimes it's the parents who fight the most who get access to the services, and some families aren't in that position or have the resources to kind of keep on having that fight. A lot of the parents of children with rare genetic conditions I've meet. It's sometimes a full-time job for the mum, just accessing the support they need for their child, and often they're only able to do that if there's financial resources within the family.
Can you speak to a little bit more? Your research was so fascinating to me. Speak more to kind of how genetics is playing a role specifically in the treatment end of it. So we have most of the viewers of our podcast are going to be those treatment clinicians who are actually providing the psychotherapy. So where do you see currently the status with autism, obviously, because that research was fascinating, and then beyond autism, what you're seeing, and then any other information or advice you have for psychotherapists globally about, really how should we be approaching this from that perspective?
So I think there's a hope that in the future we'll move towards a personalized medicine approach, whereby we're not just applying the same therapy to everyone with, say, a diagnosis with autism. Actually, we're looking at their individual sort of biological and sort of environmental factors. And so it could be that in the future we find that certain genetic groups therapies work better than in other groups. And there's been some evidence that the genetic conditions that we looked at in this study, for instance, social skills training doesn't work as well, because often there's comorbidities with intellectual disability in the genetic conditions we look at. So, and there's been other studies in the genetics of anxiety finding that a person's response to cognitive behavioral therapy is to some extent influenced by their genetics. It's at the early stages and can't yet be translated to the clinic, but we could see this in the future where, a blood test is taken and then a thorough kind of developmental history of life experiences and so on, and this all feeds into kind of a risk calculator that indicates what therapies may work with the individual.
Yeah, I think your research. From your research? So what do you think are the next steps with regard to what would you like to do if you had the keys to drive the car wherever you would like? Where would you go with it?
So I think there's Stephen. We just looked at 4 genetic conditions, but there's, due to genetic technologies, new genetic conditions are being identified every year. So it'd be to expand this work and look more widely across autism and genetic conditions. But also going back to what we discussed before is about looking at in these kind of population data sets. At the moment, we're only seeing individuals who've been diagnosed with these genetic conditions. There may be many individuals in the population who have these genetic factors and don't know it, and it'd be really interesting to know how the genetics affects their day-to-day life.
It's fascinating. Such exciting work that you guys are doing over there.
Yeah.
Absolutely. Yeah. Could you tell our listeners where they can learn more about the work of your lab?
Yeah, so on the web page links to the different work that I've done, but also I'm part of the Genes to Mental Health Consortium, and they have a web page that linked to kind of the new projects we're doing and the publications coming out of that, so I can send that afterwards.
Wonderful. We will absolutely share that with our listeners and post that link so that they can read up on it and find out more information. What you're doing is truly fascinating. I think a lot of our listeners will really be interested as they work with clients with autism. So thank you so much for being here with us today.
Yeah, and I hope as you get new developments, reach out to us, although we'll be watching, but reach out to us when you think you'd like to come on and talk more about some of the things that you're doing. We'd love to have you. Yeah,
no, it's been great, and there's lots more to discuss.
Definitely. Wonderful. All right. Well, thank you so much. And thank you to our listeners for this tuning in for this week's episode of The Barrier Breakdown. We will see you next week, and stay safe and healthy. Take care.
Thanks for listening to The Barrier Breakdown, Disrupting Mental Health podcast. Check out our website at cbrcenterforeducation.com for more information and to learn about upcoming continuing education events.